Welcome to the Community Assessment Project for Group 3 in Nursing 405. Enso County is a coastal county in eastern North Carolina that is home to both Camp Lejeune Marine Corps Base and New River Marine Corps Air Station. Jacksonville is the county seat and the largest city in the county. Onslow County is a thriving, growing, young county. The population has a very heavy military influence due to the presence of both the Marine Corps Base and the Marine Corps Air Station. The population is 185,220, and 54.5% of that population is male, due again to the presence of both Camp Lejeune and New River. Group 3 undertook a windshield survey to collect data to help us define the community and look for trends and changes that might affect the health of the community and help narrow down a diagnosis for the community. Onslow County, 76.7% of the population identified as white, 15.8% as African American, 2.1% as Asian. Individuals in Onslow County who identified as two or more races was 4.1%, 11.8% identified as Hispanic or Latino, and 91.2% said they spoke English at home as their primary language. The median household income was $45,450. 15.2% of the population are below the poverty level. 8.6% unemployment rate in the county. During the windshield survey, it was also noticed there were very busy strip malls, retail stores, home improvement stores, car dealerships, grocery stores, hotels, and restaurants, as well as several areas of new construction that were both retail and residential. Housing in Onslow County, 73.5% say they have lived in their house 1 year or more. The median home value is $151,700. 2.6 persons make up the average household, and Onslow County has a variety of housing that include both single-family townhomes, apartments, mobile home parks, and older homes being renovated, as well as the new construction that was mentioned earlier. So there are 21 elementary, 8 middle, 8 high schools. The population who are high school graduates are 90.2%, 18% hold a bachelor's degree or higher, and there is a community college in Onslow County, Coastal Carolina Community College, and it's also of note that in close proximity to Onslow County, there's the University of North Carolina, Wilmington, and East Carolina University. Medical resources in the county include Onslow Memorial Hospital, which is a 162-bed facility with inpatient and outpatient services, as well as an emergency department. The Naval Hospital at Camp Lejeune, which is a 65-bed facility. It has very limited specialty services, but it is a full-service Department of Defense hospital which serves active duty, their family, and retirees. In addition to these resources, there's the health department, 2 WIC offices, many private physician offices, Bryn Mawr Psychiatric Hospital, and dental facilities. It is, of course, important to note there seemed to be a lack of a number of OB/GYN offices in the county. So what is our community health diagnosis? We identified a key health issue that would have a major impact on the well-being of the community. Group 3 focused on teen pregnancy and repeat teen pregnancy. Onslow County is one of the top 3 teenage pregnancy rates in North Carolina for 3 years in a row. Onslow County also has a high rate of repeat teen pregnancy for these teen mothers. So in Onslow County, they have a teen pregnancy rate of 90.70% related to 55.3% for the rest of the state, 32.8% repeat pregnancies compared to 20.8%. So it's evident that teen pregnancy and repeat pregnancies are a problem in the state. I'm sorry, in the county. Teenage pregnancy demographics. 261 of 4,328 births were girls 15 to 19 years. If you break them down by race, 173 of those pregnancies were to white, 37 to African American, 7 to non-Hispanic, and 44 to Hispanic. 54 of those pregnancies were second, third, or fourth births for teenage mothers that were 17 to 19 years old. Most girls receive prenatal care of some kind during their pregnancy. So 169 received care in the first trimester, 60 in the second, 14 during the third, but 18 had no prenatal care. So what are some strengths that the community possesses that will help focus on this diagnosis and our interventions? So the community has outreach programs by the local health department that have been getting a lot of positive response from the community through schools and churches. The community is economically thriving at this time, and there's an awareness and utilization of the services that the health department provides. There is a high rate of prenatal care for these teen pregnancies. So what are some weaknesses or gaps? There's a very high teen pregnancy rate and a high rate of repeat pregnancies. There's the deficit of OBGYN providers, as mentioned before, and the low rate of high school graduation among these teens. Of the teen mothers, less than 1 in 5 will continue and graduate from high school. Some other health problems: prenatal care deficits. Clients leave the health department before a visit's complete because of long wait times and long visit times. These long visit times are due to how thorough the health department has to be because they are funded by state and federal mandates, funding, which mandates certain things be done. So their visits are much longer than what they would be if they were at a outpatient OBGYN in the community and not at the health department. There's late prenatal care. 35% of the pregnancies did not initiate prenatal care until the second trimester or not at all. And low birth weight infants were 8% of those deliveries to teen mothers. Other health problems, actual problems: child poverty is 20.4% in the county. The food insecurity rate is 24.5%. The county also has high abortion rates, and infant and child mortality is high. Potential problems are unprotected sex that the teens engage in puts them at increased risk for STDs and STI exposure, maternal exposure to measles, and child abuse or neglect. Other areas that are impacted: the health department client base, graduation rates, secondary and post-secondary education, and social welfare system. 25.3% of the mothers are on Medicaid and 17.2% are on NC Health Choice. So we have community awareness. They know that teenage pregnancy is a problem, and they're starting to request outreach and education from schools and churches. The health department is trying to meet those needs, and it's interesting that they are more receptive, they being the churches and schools, to things other than abstinence only. So our primary nursing interventions would be continue the outreach and educational efforts and using school-based education programs that continue through 12th grade, include abstinence and birth control methods education for pregnant teens regarding available prenatal care providers, and STD and STI education, vaccine programs, including things such as Gardasil, which prevents HPV, which goes right back to the STD and STI education. Partner with Marine Corps liaisons to provide contraceptive education for family members of the military, education about teen pregnancy for military members, and of course again STD, STI. As the key informant interview indicated, there are a lot of people who are either dependents of military personnel or those attached to the military in some shape or form. So educating these groups are vital as well. So that's where the outreach is so very, very important. Secondary nursing interventions include prenatal care that begins in the first trimester, education on proper nutrition, smoking cessation, and pregnant teen support groups. The education for nutrition could be during lunch that meets once or twice a week and would stress the process of pregnancy and how important it would be for the mother that once she delivers to continue her education and what to expect during delivery and recovery, and give them parental guidance and an opportunity to discuss personal issues for the teen. Tertiary nursing interventions, postpartum care. Birth spacing education. Birth spacing is basically planning your pregnancies. Birth control method education, reinforcing importance of maternal, secondary, and post-secondary education. Reinforcing with these teens that education is vital to the health of their child and theirs. Enrollment into appropriate healthcare programs for both the mothers and the children, and education to decrease the rate of infant and child mortality. So when they come to the county health department, they get a yearly physical with STD, STI testing, counseling on family planning, family spacing, prenatal vitamins. They have an opportunity to choose the form of birth control they like to use. If the patient is 21, they get a pap smear. And if they don't have health insurance, the county pays for a year supply of their choice of birth control. So what are some available community interventions? There's the Women's Health Program at the local health department, the birth control availability, and the community outreach in conjunction with schools and churches. There's also a collaborative effort between the health department and the peers program, and a sheet outreach program which emphasizes abstinence. These programs focus on parenting basics, on how to be a nurturing parent, how to cope with divorce, discipline strategies for parents to use, and nurturing the unique military family. The limitations are the number of providers to number of patients in the county at the health department and the amount of state and federal funding available for the programs. Potential barriers are a willingness to participate in outreach and the censorship of information provided. Community health issues of concern are first-time and repeat teen pregnancies. Primary interventions include outreach and education, and secondary interventions include prenatal care and pregnancy support. Our tertiary interventions are pregnancy prevention and promoting bright futures for the families. Thank you so much for your attention to our presentation.